Hello, everyone, and welcome back to the Hidden Links Masterclass. We are diving deep into the root causes of autism, ADHD, sensory challenges, and other neurodevelopmental and neuroimmune conditions. My name is Dr. Beata, and I'm a holistic and integrative doctor. And if you haven't seen part 1 yet, this is going to be part 2. I really invite you to go ahead and register to get access to part 1. Part 1, we go deeper into the conditions and some of the signs and symptoms to look for, as well as some of the foundations for these root causes that we're now going to dive deep into for part 2. So if you haven't yet, go ahead and click the link below. It should be in the description or the comments section. And all you need to do is enter your email. And then on the second page, make sure that you get all the way down to the bottom of the page and get your free ticket. On that free ticket, when you get access, you have access to the members area. This is a community where you can comment and share your experiences in a more private setting than here on YouTube or social media, depending on where you're watching. And you also get access to bonus resources. So things that are going to be really helpful on your journey that I'm going to be sharing in this part 2 as well. So if you haven't yet, make sure that you do that. And again, it's all free to sign up. Welcome to the Radiant Health and Wellness community. Throughout each video training and masterclass, we explore perspectives designed to empower you and activate your radiant health, wellness, and vitality. My name is Dr. Beata Harasim, and I created the Radiant Health Protocol, an integrative system utilizing 6 pillars to master your health and wellness from within as you make your body your ally on your journey to optimal well-being. This protocol is the solution for various signs and symptoms, stages of life, diagnoses, and conditions. Join us as we take a deep dive into just one aspect of health and wellness right now. And these episodes are for educational purposes only. Please consult with your physician or a practitioner before making any changes. Let's go. Your journey to radiant health starts here. And it is also important to mention that engagement and feeling connected is really important on this journey, whether it is for yourself or if you're a parent of a child. So make sure, again, either on social media or YouTube, depending on what you feel comfortable with, or especially in that private community, to drop your aha moments as you're going through so others can catch them too. Share your experiences or questions because you are not alone in this journey. And I will come back around and answer the questions that you have. And again, feel free to share as much or as little as you feel comfortable with. And it is an important disclaimer that this masterclass is for educational and informational purposes only, and it is not medical advice. Please consult your physician or a practitioner before making any changes to health routines, treatments, or therapies. So just a quick review and recap of part 1. And many of you have seen this, right? There's studies, news, and social media linking Tylenol and vaccines to autism. And so this has gotten a lot of attention recently for good reason. And as important as these pieces are, they are just pieces of the puzzle. They're not the whole picture. And that's what we're diving deep into in this masterclass. And again, there has been a drastic rise in autism and ADHD and sensory challenges. And we need to start understanding the full picture to understand what's going on. And that's why we're going to be diving deep into genetics and epigenetics, gut health, detox pathways, and nervous system regulation. These are the major players. These are your master regulators of your being, your well-being, your body, your emotional state, etc. And when we understand that full picture, we can support real lasting healing. And again, it's important to note that the current medical system, the way that it's set up, it is not designed to keep us healthy. It is not designed for us or our children. It is designed to push pharmaceuticals. It is designed to manage symptoms instead of getting to the root cause. And that's what this masterclass is all about. We're not talking about surface level. We're talking about root causes, the things that actually make a difference. So this is different than many, again, mainstream, I would say, medical providers and other practitioners who wouldn't even dare talk about some of these subjects. That's what we're diving deep into. So why root causes, right? And again, in part one, that's where we went deeper into this, that symptoms that we're seeing and the labels that ourselves or our children may have gotten. So whether it is autism or ADHD or sensory processing disorder or any other of those, they are just labels and symptoms. They're all our body communicating with us. So if we don't understand what our body's communicating with us, we're missing the whole picture. If we suppress symptoms, we're not getting the actual message of what's going on inside. So symptom management doesn't solve the underlying issue. Identifying root causes and addressing them appropriately is what creates lasting change and not temporary fixes. And the earlier that you have this understanding, the better the outcomes for kids and families. Now, I also want to mention this, that there is no age limit for when you can see healing. So if you are catching this with your child as a baby, wonderful. If you are catching this with your child when they're a toddler or an older child, or even into adulthood, or even for yourself, if you're an adult and you're recognizing that there is healing possible for you, it doesn't matter your age. That doesn't limit anything, okay? There are going to be some challenges and some benefits of starting at different ages, and healing is possible for everyone. Here again, we are addressing the root. This is what helps the body regulate, heal, and thrive. And this is based on the Radiant Health Protocol, a system that I've co-created and experienced personally with my own healing, with my daughter's healing, and thousands of other families around the world have used these concepts to experience healing themselves. So again, the Radiant Health Protocol, the picture with the tree, has lots of different signs and symptoms that we may be seeing in the green, okay? There's many more that I couldn't fit in this picture, but the root causes are all the same. On one side is gut health, which includes holistic nutrition, right? How are we nourishing ourselves, and integrative detoxification? And then on the other side is emotional energetics. So understanding how our emotions are affecting us, but this also goes into nervous system regulation and decoding the body, understanding that language that the body is giving us. And again, I'm going to teach you ways that you can decode your body, yourself, or your child's right now in just a few minutes. So this is where it all begins, okay? The gut-brain connection, because you've seen, again, the symptoms, they can show up in so many different ways. And they can be focus related, they can be behavior related, digestion, sleep related, as well as development related, right? Developmental regressions or pauses. But here's the truth that most people never hear. The brain doesn't just control the gut controls the brain. And some of you have heard that your gut is your second brain. I actually believe it's your first brain, because when the gut is inflamed or imbalanced, it actually sends distress signals to the brain. And these affect emotional regulation, mood, development, focus, learning, memory, sensory processing, behavior, sleep and energy levels, inflammation. So it's not just quote unquote ADHD or autism, okay? Or ASD or SPD or whatever other letters, right? You may have gotten a diagnosis. And even if you haven't gotten a diagnosis and you're recognizing some of these patterns and symptoms in yourself or your child, this is applicable to you too. All of this is just a reflection of what's happening inside the body. And the good news is that we can begin to rebalance it. And this is where root cause healing truly starts, in the gut. The gut is our foundation. In the nervous system, these are all closely related. In the body's ability to detox, to repair, and to regulate. We're working with the actual systems of the body. That's why this is science-based. This is literally how our body functions. So are you ready to start uncovering the root causes and finally get clarity? If it's a yes for you, let's get going, okay? So what we're going to start with is genetics and epigenetics. And this is so important to understand because when I first started diving into the genetic side of neurodevelopmental health, I realized something profound, that genes actually don't dictate our future. They give us a map, it's our blueprint, but how we live, eat, the toxins we're exposed to, our detox pathways and stressors that we're exposed to, our nourishment, these are what actually determines what gets expressed. So we know that these conditions are not purely genetic, because when autism is diagnosed, okay, in identical twins, sometimes only one twin has it. So if it was genetic, that wouldn't be the case. Does that make sense to you? And you may have heard of MTHFR or COMT, and these are genes that help regulate methylation and detoxification. And these genes influence how we process folate and even neurotransmitters like dopamine and serotonin. Now, there are other genes that are really important in this process and our detox pathways as well. CBS, GST, GPX, SOD, DAO, et cetera, et cetera. But I'm just going to use MTHFR and COMT right now for our examples and your action steps, because you're actually going to have practical steps that you can start taking forward. So when we have mutations or variations in these genes, okay, what can happen is our detox pathways can become sluggish. What that means is that the body has a harder time clearing out toxins like heavy metals, chemicals, and even stress hormones. These can build up easily, and they create inflammation in the gut and the brain. Now, here's the empowering part. Through the study of epigenetics, we know that we can influence how genes behave and our body's processes. So what this means is we're going to go deeper into some of these pathways, but let's say a pathway is supposed to run at 100%, depending on the variations that you have in those genes, maybe your pathway is only running at 25% or 50% or 75%, right? It depends on the individual, but that's going to affect the signs and symptoms that you're seeing, feeling, and experiencing. Does that make sense to you? So what this also means is with that epigenetics piece, we can influence how these genes behave and again, how these processes work in our body. So that means with the right nutrition, detox support, gut health, environment, we can actually help those pathways function more efficiently and reduce the load that contributes to challenges like autism, ADHD, or sensory processing differences. And what ends up happening is we have a higher quality of life. We have improved function. We have improved emotional regulation, etc. So on this next slide, I'm actually going to show you how you can start decoding your body signals or your child's. And these are signs that these pathways might be under stress. And this is the thing, that you don't necessarily need genetic testing, okay? There are options to get genes tested, but it's not always required. And that's important to note, that we can do things and decode your body to support it optimally, sometimes without getting genetic testing. That is an option that I do offer for those who are interested. And again, it's not always needed. So the main point I want you to take away here is that your genes are not your destiny. They're just a blueprint, and blueprints can be optimized, okay? So let's talk about decoding our body, right, or our child's. So our body leaves clues, and these can be physical, behavioral, energetic, about what's happening beneath the surface. And maybe some of you have seen some of these. So our body is always communicating, and especially our children's, and especially when they're babies, they're literally born, and already we can start decoding some of these things. So if you know what to look for, you can actually decode the messages and understand what that means. And this is part of the Radiant Health Protocol. And again, something simple that I can teach you today. And you get a sense of empowerment and understanding what your body or your child is communicating. So when we look at these pictures, things like tongue and lip ties are a sign of one of these genetic mutations. So if you're not familiar with tongue and lip ties, they are when there's an extra piece of tissue that holds down the tongue or the lip. There's also buccal ties, which connect your cheek to your gums, and they restrict oral movement. Now, these are all signs that there may be a MTHFR genetic mutation. Same thing with this sacral dimple here. Any kind of midline defects like spina bifida, that's more serious, okay? These are neural tube defects. These are signs that there is likely a MTHFR variant that you or your child has. Now, there's also signs that you have detox challenges, that again, there are genetic variations going on that are, again, that pathway isn't functioning at 100%. It may be functioning at 25, 50, or 75, or a different percentage, okay? So these signs are chronic congestion or eczema. And again, these can be showing up in babies, little babies. They can be showing up in adulthood or older childhood or whatever it may be. And now we're also looking at the family line, right? So recurrent miscarriage or infertility in the family, again, is a sign that you may have some of these variants. Chemical sensitivities or poor tolerance to medications and supplements is also a big sign of this. I have a funny story about that I'm going to share in a minute. Low energy, anxiety, or mood swings, again, a sign that you likely have some of these variants going on. Developmental delays or sensory sensitivities, again, a sign. And then family history, right, of autism, ADHD, also autoimmunity or chronic inflammation. These are all related. Okay, so what I want you to know is that these are body's messages, not malfunctions, okay? And yes, like structural issues, we want to have them addressed appropriately, and I'm going to share resources with you for doing that. And we are shifting our way of how we're thinking of our signs and symptoms, okay? This is meant to be empowering and understanding how do we work with our body based on what it's communicating to us, okay? So I remember, this is the funny story, when I was, oh my gosh, it was 20 years ago. So I was a young adult, right? And I remember this was my train of thought, okay, at the time, that I was working at Staples part-time while I was in school, the office supply store, literally Staples. And I was under my parents' insurance, and my dental insurance was going to be ending soon because I was going to age out or something like that, right? So I'm thinking, man, my wisdom teeth aren't bothering me. Not a problem at all, but I need to get them taken out because my dental insurance, I don't know what my situation is going to be coming up. So even though I had no issues with my wisdom teeth, I decided to go and get them removed proactively. Many dentists will do that for you. So I went and I had the anesthesia and I came out of it and I felt horrible. Like literally it felt like a truck hit me. And I didn't understand this at the time at all. But what I know is that, yeah, my mouth was sore from where the wisdom teeth were extracted, but my body felt horrible. I vomited for like a week straight. I had no energy. I was literally bedbound or couch-bound, right, at the time. And I couldn't understand what was going on because other people had gotten their wisdom teeth out and it was like a day or two and they were fine. And I remember for work, right, for Staples, I remember calling or ahead of time being like, I'm going to be getting my wisdom teeth out. So don't schedule me for these 2-3 days. I should be fine afterwards. Well, 2-3 days passed and I was still feeling horrible. Well, so I remember calling my manager and being like, oh my gosh, I'm so sorry. Like, I can't come into work. I have to call out. Like, I feel horrible. And he called me Mumbles from then on because he's like, I can barely understand what you're saying, Mumbles. And I didn't understand it at the time, but I was having a serious reaction to the anesthesia because now I know that, yes, I do have these genetic variants and my body does not detoxify and process nitrous oxide well, which is, again, the anesthetic or the laughing gas, right, that they use often for dental procedures and some other procedures. And so the funniest thing of all is that this was what, 20 years ago. One of my other managers from Staples and I just connected What are the chances? And he's on a similar health journey as well. And so it's just so amazing to see how that cycle completes. But that's an aside, right? But so you yourself, right, as the parents, right, as an adult, may have signs and symptoms that you have some of these variants and you may not know it. So we want to be able to understand what our body's telling us. Now, knowing what I know, I can look back at that scenario and say, oh my gosh, of course I was feeling horrible. Makes total sense, okay? So when we start, again, understanding these signs and symptoms and we approach them with curiosity instead of fear, everything shifts and you move from guessing to decoding. So I want to take a moment to pause and really focus on these tongue and lip ties and oral ties because it is something that is so important to address. Because when this is happening, we are again showing that we have variants. We need to support our detox in a specific way. We need to support our nourishment and our nutrition in a specific way. And the impacts are great. And so this can often be picked up as in childhood, right? As a baby, but it's often missed as well. And this was our personal journey. My daughter's ties were missed for over a year, and I suffered the consequences of that. She suffered the consequences as well. But one of those is impaired, like difficulty breastfeeding or feeding. And so oftentimes people, moms who have kids, babies who have a hard time breastfeeding, this is something we need to have evaluated. And even older kids, if they're having breathing issues, if they're having sleep issues, this affects airway, okay? Our airways, which are so important because if our airway is occluded or it's not open all the way, this breathing impacts development, it impacts brain health, it impacts focus. So this is a key root cause to be aware of. And we need to have it assessed and evaluated appropriately. So again, myself, I remember when I had the lactation consultants at the hospital take a look at my daughter and they said, oh no, she's fine. And many of clients that I've worked with have gone to regular dentists or ENTs to have their children looked at and they said they were fine. You need to go to someone who knows what they're talking about. So what I have made through the years, because I have initially started my practice with breastfeeding moms and their babies, helping them just like I helped my daughter. So these ties were so crucial to have assessed appropriately. And we need treatment for them appropriately. So what I did through the years is I've created an international list of preferred providers. These are providers who are familiar and competent with ties, and they know the treatment necessary because sometimes there's body work necessary or myofunctional therapy, which is working with our muscles and our oral cavity. Sometimes there is body work overall. So things like craniosacral treatment, certain chiropractors or orthopedic manual physical therapists like myself as well do this. And there are also occasionally needs for surgical I forgot the name for it, where they cut it essentially, okay? So what we need to do, or a release, of course, an oral release. So what we need to do is we need to have the appropriate assessment to see if this is necessary. And again, there's steps to the process and we need to be aware of those steps. And that's something that I support families with deeply because I've gone through this process myself and helped others as well. But first off, you need to get assessed by a preferred provider. So again, for those who are registered to this free masterclass, you will also get access to that free preferred provider list. So if you haven't signed up yet, make sure you click below, sign up and register. It's free and you get that resource as well. Now, these are really important. Again, I will harp on this again, airway, airway, airway. If we're not assessing airway, we could be missing a huge root cause of what's going on for our children or ourselves. Now, there are also other signs and symptoms that have been going around, for example, on social media, or you may see pictures of them that can suggest MTHFR mutations. So things like strawberry hemangiomas, stork bites, or angel kisses, where it's between the eyes. Now, the lip tie, tongue tie, sacral dimple, midline defects, these have research behind them. These other ones, the strawberry hemangioma, the stork bites, etc., these are more anecdotal. So I have included them, but I want to be, straightforward with you that I have not found any research to scientifically back that up other than the oral ties and the sacral dimples and the midline defects, okay? And it's important to listen to each individual and see the patterns. So again, if you are noticing these things in your children, again, approach it with curiosity. I wonder if this could be affecting my child or myself, et cetera, et cetera. So I wanted to mention those as well. Now, we're going to start going deeper into what all this means, right? Because MTHFR, you're like, okay, cool, it's a gene. What does that mean? And we're going to talk about methylation, which again is a little bit more of a advanced concept, but I'm going to make it simple. And I'm going to, again, with everything, give you an action step so you know what is that next step for you. So the first thing I want to mention is that MTHFR variants are quite common, okay? So many people carry one genetic mutation and some carry two. However, having a variant doesn't necessarily mean you're destined to have these huge health issues, okay? I also want to mention that. But what it does mean is that you may have less of a buffer if there are other stressors that come into play. So things like toxins, vaccines, nutrition, gut issues, etc. And then COMT variations are common too. But again, it really depends on the whole picture. So we don't want to just look at single genes. And that's some of the limit of genetic testing is we're only looking at the genes. Well, let's look at the person, right? Let's look at how this is affecting the person. So we are going to go into methylation. And again, we're just going to make this simple, but it's one of the most fundamental yet misunderstood processes in the human body. So it's essentially called, not called, but it's like your body's handyman, okay? Or I think of it like a transformer, like for kid terms, okay? Or you can think of it like a delivery truck. What this does, this process, is it adds a small chemical tag called a methyl group to molecules like DNA, like neurotransmitters, which are your brain chemicals, and even toxins, okay, for detoxification purposes. Now, this little tag determines how the molecules behave. So it can literally impact whether a gene turns on or off. Okay, so again, that epigenetic piece, this is what we're talking about, that literally how well your methylation cycle is working affects your genetics, which again has this feedback loop essentially, okay? And at the same time, these little tags, okay, determine how effectively we detoxify, how balanced our mood and focus is, and even how well we sleep. Can you feel how big this is? This impacts so many processes in the body and so many aspects of how we or our children are feeling. Now, methylation essentially helps convert tryptophan, which is an essential amino acid, which all that means is that it's something that you have to consume from your food, into serotonin. And that is our happy hormone. And then it turns it into melatonin, which is our sleep hormone. So can you see that cascade? A little side note and bonus for you is that tryptophan is found in animal products, so especially meat, okay? And I know, again, we're going to talk about picky eating and some of those challenges where some kids, for example, will refuse to eat meat and will refuse to eat certain things. But again, tryptophan is so important because it's an essential amino acid. We need to be consuming it because otherwise that whole cascade is not going to work. So our little hormones for our brain, our hormones for our sleep are going to be, we're not going to be able to produce them. That process is disrupted. So what we need to do is we need to make sure that we are consuming that in one way or another. Nuts and seeds are another way, etc. Now, what this process does is it helps move something called dopamine and norepinephrine, again, which are neurotransmitters and chemicals, right, for our brain through their pathways, which again is key for focus, mood, and motivation. So in fact, 60 to 90% of our DNA needs proper methylation for normal function. Like that is how essential and important that is. So why does this matter? This regulates gene expression, which again, it turns genes on or off. It helps detoxify heavy metals, environmental toxins. It supports mood, focus, and sleep, aids in cellular repair, memory formation, vascular health, neurologic, and brain health. So when we're talking about that methylation cycle and that MTHFR gene, we need that pathway to be working well, because what it does is it converts something called folate, which is vitamin B9, into its active form, which is essential for efficient methylation. So certain variants in MTHFR, some common ones are C677T, A1298C, etc., can make this process less efficient, which means that the body may struggle to clear toxins or produce these neurotransmitters effectively, okay? So it doesn't mean that the system's broken, right? If you have these variants, it's not like you're, there's nothing you can do. This is the empowering piece. There is something that we can do. All it means is that our body or our child's body may need extra support, again, through nutrition, through detoxification support, through lifestyle, to keep this cycle running smoothly. So this is the piece that there is something that you can do. And there's clear steps. We're going to go through some of them in a few minutes. So if your child struggles with focus, behavior, or mood, or you notice poor detox tolerance, fatigue, anxiety, this is one of the core pathways that we look at to truly understand what's going on underneath. So now that we are understanding the methylation process, okay, now that we understand how methylation works, let's talk about one of the biggest roadblocks, and that is folic acid. So folic acid is the synthetic form of vitamin B9. It is added to all sorts of foods, cereal, bread, anything that has enriched flour in it, many processed foods, even multivitamins and prenatal vitamins, okay? Now, this is the problem. So if someone has an MTHFR variant, their body struggles to convert that folic acid into the active form, which is called methylfolate, or 5-MTHF. So this unconverted folic acid, right? If we can't convert it, it's synthetic, it can build up and block folate receptors. So what this means is that it prevents the real active folate from doing its job. And therefore, all of those processes that we just talked about can't do their function, okay? So folate is the natural form from foods like leafy greens, avocado, liver. And what it does is it skips those extra conversion steps. So as long as our digestion and our gut health is optimal to be able to absorb it, it can be readily used by our body for methylation, for detox, for neurotransmitter balance, and for DNA repair. Are you understanding how important this is? If we can't process folic acid and we're eating it and we're consuming it, it's literally blocking our folate receptors, which block all of these important pathways and processes in our body. We can't detox. I mean, we can, but it's going to be highly impaired, okay? Our neurotransmitter balance is going to be off. Our DNA repair is going to be off. Our inflammation is going to be off. Now, there's also something that is widely talked about called folinic acid. And this is kind of like a middle step. So it's partially converted and often well tolerated by some sensitive individuals. And then there's something called leucovorin, which is what RFK talked about recently. And this is a prescription grade folinic acid that's sometimes used in clinical settings to support neurological development. And again, especially with children with methylation or folate transport challenges. Now, this is the piece that many people kind of get confused about. They're like, which one do I know, right? How do I know what I need? What do I do, etc.? So what we need to first do is, if you have any inkling of suspicion that you have some of these genetic variants, the first thing that you need to do is we need to look at the places where we may be getting folic acid, whether it is from processed foods, from enriched flour, whether it is from vitamins or prenatal vitamins, etc., because our health as mom and dad is going to affect our child's health as well. We're going to talk about that later as well. And so even as adults, right, if we are noticing these signs and symptoms in ourselves, we need to be aware of this too, okay? And we want real whole food sources. So again, leafy greens, lentils, liver, and gentle natural forms occasionally like methylfolate or folinic acid when it's appropriate. Now, this is the thing that I work with clients and individuals and families to determine the right form of folate for them, because there are, again, signs and symptoms that we're looking for. And something safe for everyone is to go with these real food options. And that is the best choice if you can. Okay. And again, I know what picky eating looks like, and I know how challenging that can be. And there are ways to do this. Okay. There are ways to do this with babies, with toddlers, with young children, with older children, with adults. I have plenty of experience in this area and lots of tips and tricks for you. So again, the overall takeaway is if your child or you have symptoms of poor methylation, okay, things like fatigue, irritability, chemical sensitivity, developmental delays, any of those things that we mentioned earlier, your genes are not your destiny. With the right support, and again, avoiding folic acid and using the right form of folate can make a huge difference, and you can optimize methylation and give the body a chance to thrive. So one other thing I'll mention is that you don't need the prescription, because that's what a lot of people are sharing. And, there are many people who benefit from leucovorin, and there are natural ways to get this without needing a prescription. So I want to put that out there as well. Now, when we're talking about, again, methylation and detox pathways, we need to talk about environmental and other toxins, right? The toxic load in general, and what can be stressing the system and the body. So when we think about it, through the years, humanity has faced these challenges, right? Hundreds of years ago, it was survival, okay? Now, at this age in our modern world, for us, it's actually keeping away from toxins, staying away from toxins, and empowering ourselves about our health. Because when we're talking about neurodevelopmental challenges, we need to look at all toxins, okay? Every day, our bodies, and especially our children's developing bodies, are exposed to thousands of chemicals. I'll say that again, thousands of chemicals. These include plastics, pesticides, heavy metals, and even things like 5G, mold, and even things like everyday household products. And our food, processed food, does contain toxins in them, and supplements. I will mention that as well, because a lot of people think, well, I'll just take a supplement instead of eating real food, okay? And that can have a time and place. But did you know that if you're looking at supplements, there are actually many additives and preservatives and things that your body doesn't recognize in many supplements. So myself as a practitioner, I rely on whole food. If we need a supplement, there are times I find the highest quality ones that I recommend, those are the only ones that I recommend, and real food sources. So there are, I call them like quasi supplements, where it's actually a real food, but it's so concentrated in these vitamins or minerals that we need that it's a natural supplement that you don't, again, your body recognizes it. It doesn't need extra to process it. So when we're looking at developing brains and bodies, they're especially sensitive to toxins. So even small exposures can add up over time. And I will say that my daughter was one of these, because we tried supplements, okay? We early on in our journey, we went to lots of practitioners who recommended lots of supplements. She wasn't able to tolerate them. And so she was having reactions to things that should have been helping her. And so what it brought me to is this place where I needed to figure out, how do I help her? How do I support her without the supplements? And how do I do it with her picky eating habits, okay? And sensory challenges and texture challenges, etc. And there are ways, okay? So if anything, I want you to feel the hope and the confidence that I have for you and your child on this journey, okay? I've been there, I've done it, and I know you can too. So ultimately, right, how many times have we heard this, right? They tell us that a little bit won't hurt. a little bit of aluminum in the vaccines doesn't hurt. And we're going to talk way about that deeper in a couple minutes. A little bit of aluminum foil doesn't hurt. Aluminum's a heavy metal. Let's be serious, okay? We know that small exposures over time create big consequences. That's why this movement that I am so passionate about is not about fear. It's about empowerment. It's about freedom. Freedom to know, to choose, and to lead our families with wisdom. Because we don't want these toxins in our lives. And by taking these steps, we're reclaiming our freedom and our health. So it is important to mention that we have innate, built-in detox pathways in our body. Things like the liver, for example, is a detoxification powerhouse. But if it's overburdened with toxins, it has a limit. It can only do so much. So we have these innate pathways that we need to learn how to work with. And again, we're going to go deeper into detox pathways in a couple minutes there. And then we need to look at gut health, because gut health helps to, again, detoxify. It works hand in hand with detox pathways. But when we are exposed to toxins, for example, glyphosate or Roundup, which is a pesticide, this actually destroys our gut microbiome, and it creates a condition called leaky gut. We're going to go deeper in leaky gut as well in a couple minutes. I've packed a lot into this masterclass. That's why I've broken it up into parts. Now, toxins affect our nervous system regulation as well. So if we're exposed to lots of toxins, it's going to influence neurodevelopment and behavior. It's going to put us on edge. It's going to have our nervous system be on high alert all the time when it's being exposed to all these toxins. Does that make sense? And we know, again, autism, for example, is not purely environmental, because not everyone with particular exposures will get autism. And that's something that we'll talk about with the vaccine conversation that we're going to have, because that is real. We need to listen to everyone's stories and everyone's experiences and acknowledge their valid experience. Now, we also are going to talk about medications, because things like Tylenol, antibiotics, vaccines can act as the trigger. I'll say that again. Medications like Tylenol, antibiotics, and vaccines can act as the trigger. This is what I call like lighting the fire, okay? Particularly in those with genetic vulnerabilities like the MTHFR, COMT mutations, etc. This is where that can be the straw that breaks the camel's back. And this is also where epigenetics comes in, because when we can limit our toxin exposure, when we can improve our environment, when we improve our nutrition, when we decrease stressors, we can literally turn genes on or off. And this influences how the body responds to these exposures. So the good news is that we don't have to wait for symptoms to appear or get worse. We don't have to wait for a diagnosis. By supporting our detox pathways, by improving our gut health, by limiting toxin exposure, by optimizing our nutrition, we can reduce this toxic burden and give the body the tools that it needs to process exposures safely. Now, the first step is limiting our exposures to toxins, okay? And that's why, again, for everyone who's registered for this masterclass, you are also going to get my free toxin-free living guide. All right, so you're going to get access to that. And it has easy, simple swaps that you can start making, and the awareness to start making these decisions for yourself and your family. Because again, it's not about avoiding everything. It's decreasing the toxin exposures that we can, right? What do we have agency over? And it's about optimizing resilience so that the body can handle what it encounters. Does that make sense to you? If we have a huge toxin load, let's decrease it. Let's decrease the burden on our detoxification pathways, because the more those toxins build up, the more that we have to detoxify, and then things can back up, and then we get inflammation. Let me know if this is making sense to you so far. Let me know what your aha moments are, because this is so crucial for understanding, again, that bigger picture.